Hello everyone. In this video, I want to talk about mood disorders and suicide. And I'm just going to talk about two of the most common mood disorders, major depressive disorders, and then also bipolar disorder, which you might know of as manic depression. And then I'll talk a little bit about suicide as well. So major depressive disorders is definitely one of the more serious mood disorder. Depression is the leading cause of disability from ages 15 to 44, which is kind of amazing to even think about it. But these are physically healthy people that are disabled because of depression. So most of us will experience a depressed mood here and there. And how do we know whether or not we have a major depressive disorder or whether we're just depressed? So we're going to talk about that in the next slide about the symptoms of major depressive disorder, because most of us experience a depressed mood here and there because bad things happen. Right now we all may be feeling a little depressed because of COVID and all the restrictions and all the frustrations with that. But we may not experience what we call a major depressive disorder. About 1 in 5 people will experience a major depressive episode in their lifetime. So about 20% of us. What are some of the causes of major depression? Well, we know that there's definitely a genetic component. If you have a first degree relative, which would be a parent, you have a 50-50 chance or so of also suffering from depression as well. We also know there's 3 different neurotransmitters involved in depression, so that the biology in the brain is different with people when they become really severely depressed. There's low levels of norepinephrine, serotonin, and dopamine in people that are depressed. And our medications for depression actually increase the level of these different neurotransmitters. And there's also a cognitive and an environmental component. So we know that your thought processes have a lot to do with your mood, also with your level of anxiety. So we know that you can improve your mood by your thought process, and we also know that we can make ourselves feel a whole lot worse with our thought processes. And the same with anxiety. We can increase our anxiety by how we think about things, or we could actually decrease our anxiety by how we think about things. And we all have kind of a constant dialogue running in our brain about how we're doing or not doing. And a lot of times we ignore it and don't pay attention to it, but it really can have a huge impact on how we feel about ourselves and in our mood as well. So we really want to look at our thought processes, and is our thought process helping us or hurting us? Because that's definitely linked to depression as well. So this is the DSM-5 criteria for major depression, and you have to have the symptoms for at least 2 weeks or longer. So you have to have a depressed mood every day, all day, for at least 2 weeks in order to meet the criteria for major depression. So, you may have something bad happen to you and feel bad for a couple of days, but that doesn't mean that you have a major depressive disorder. But if it lasts longer than that, if it lasts weeks or months, you might start to have some other symptoms as well. So, losing interest in things that you normally would enjoy doing. You don't want to go to your favorite movie that just came out. You don't have any interest in it, and that's a sign that you're depressed. There was a comedian once who has said that depression isn't about being depressed about something sad happening, but it's really being depressed and not being able to enjoy things when everything's going great. So depression a lot of times doesn't make sense to the rest of us, because why can't you just snap out of it? But oftentimes the brain chemistry has changed so much that people just can't snap out of it on their own. So some people with major depression will want to eat a lot. Some people won't be able to eat at all. Some people will sleep all the time, and some people will have trouble sleeping. Psychomotor agitation just means people are agitated. They have kind of extra energy, kind of bouncing around. A psychomotor agitation in depression could come across as irritability and anger as well. So a lot of times we think of people being depressed as being having psychomotor retardation, where they're slow and they have low energy, but that's not always the case with depression as well. And then feelings of worthlessness, trouble concentrating, trouble making decisions, and the suicidal ideation are all parts of major depressive disorder, and really indicates the level or the seriousness of the depression. And it's really important to get help with your depression. if you start to have a lot of those symptoms there, because you may not be able to get out of that depression on your own. And the longer that you wait to get treatment, the worse your symptoms are going to get, and the more time it will take to recover from those symptoms. And that's also true for anxiety. I don't know if I mentioned that before, but it's really important to get help early. The longer you wait to get help, the longer the treatment is going to take. If you remember Chad from the video on Obsessed, he had so many rituals and so many OCD rules, and it just sort of consumed his entire day. And if you think about it, how is he going to be able to, how long is it going to take him to overcome all of those different things? It's going to take a long time. And the same thing for depression. The more depressed you get, the harder it is to get out of that depression. So the first medications for depression were developed in the mid-1950s, along with the antipsychotic medications that we'll talk about later. Prior to that, we didn't really have any treatments for any of the psychological disorders. We just tried to talk to people and find a comfortable place for people and comfort them, but we didn't have any real treatment. So the first medications were called tricyclic antidepressants, and the three that I put on here, amitriptyline, tofranil, and Pamelar, they're not prescribed as often today because they do have increased side effects. They cause you to have cotton mouth and weight gain. But amitriptyline is actually a pretty popular medication for people that suffer from anxiety as well as depression. Works on that serotonin level and it increases that serotonin level. But it also has a calming effect on anxiety. The most common antidepressants that are prescribed today are called SSRIs, and they increase the level of serotonin in the system. And Zoloft and Paxil and Prozac are all ones that you all may have heard of. There's also SNRIs, which actually work on that norepinephrine level, so Cymbalta and Effexor. And there's also a new it's also not uncommon for people who are depressed to get prescribed two different antidepressants. So initially they may have been prescribed, say, Paxil, and after several months they're still not feeling very well. They might add a second antidepressant that acts on a separate neurotransmitter to help with that level of depression. There's also Wellbutrin, which acts on your dopamine system and increases that level of dopamine. And then there's also some other older antidepressant medications that are pretty rarely prescribed, but often it takes a long time to really find the right medication for a person. I wish we had like a blood test where you could take a blood test and they could say your serotonin level is low or your norepinephrine level is low and this is the medication that's going to fix that for you. We don't have that. So when you go to a doctor to get medication for depression, they're making their best guess based on your history and your symptoms as to which medication might work best for you. And they might guess right and they might not guess right. And if you can imagine having to, being very severely depressed already, going to the doctor finally and getting prescribed something and then it doesn't really seem to work. So that's one of the problems, is that people tend to give up way too soon sometimes on medications. And to really find the right medication and the right combination of medication for people can be a real challenge. So definitely something to think about. But antidepressant medications really have been shown to be effective. There was a really comprehensive study done in 2018 that studied 115,000 people that were starting on an antidepressant medication. And about half of them reported a 50%, actually more than that, 2/3 of them reported that their depression was reduced by 50%, which is pretty significant. But there still was a third of people that didn't respond to the medication. And that is a real problem in psychology and with medication, is trying to figure out which medication works right for which person, what dose works right for which person. And then there are people that just don't respond to medication at all, which is unfortunate too. So the medications this study found to be most effective were actually Elavil, which is one of the older antidepressants, amitriptyline, Effexor, Paxil, Trintellix. I don't have a picture on there, but definitely there's still a lot of research being done. Lots of new antidepressant medications are being developed to try and reduce side effects and effectiveness as well. They're also looking at what we call genome testing. I don't know if you've heard of this with some different cancer research programs, but what they're doing is they're looking at a person's genetic makeup, and if they respond well to a particular medication or a particular cancer treatment, they're monitoring those people, and if somebody else has that same genetic makeup, they'll prescribe that same medication or that same cancer treatment. And they have found some links with cancer treatments between genes and responsiveness to certain treatments. So that's something we would definitely like to do in psychology as well. So counseling is a really important and effective treatment for anxiety and for depression. Cognitive behavioral therapy is kind of the gold standard, the most common therapy that you would probably get if you went to a counselor. And it's really looking at your thought processes, changing those negative, irrational, automatic thoughts that we all have to more realistic thoughts. It's not pretending everything is wonderful or only having positive thoughts, but it's really evaluating your thought process and how you can change it in order to change your mood and change your life, really. Because I think a lot of us feel like in order to be successful in life, we have to be hard on ourselves. And honestly, the opposite is true. The more realistic you are in your thoughts, the more successful you'll be in life. But oftentimes when people, especially when people get really severely depressed, they need a combination of both medication and counseling to get relief from their symptoms. And one of the things that we mostly associate with major depression is suicide. However, many people with all sorts of different psychological disorders attempt suicide as well. 90% of people who attempt suicide have an untreated and diagnosable psychological disorder, and it's not always depression. So, we do relate depression and suicide, but often schizophrenia, bipolar disorder especially, really are involved with suicide as well. So I put these different risk factors, if somebody has previous suicide attempts, if there's a family history of suicide. A lot of times when people attempt suicide, it's a pretty impulsive act. Sometimes it's very well planned out, but sometimes it's also very impulsive. Oftentimes people might be high on drugs or drunk from alcohol, and not in their right mind when they're making that decision as well. And I had another slide that talked about most suicide attempts do actually fail, and that's true, but mostly with women. So women tend to choose much less lethal methods of suicide. Women tend to take an overdose on pills, and oftentimes your body will reject those pills, cause you to throw up, and then you don't die from that overdose attempt. But men tend to choose much more lethal methods. They tend to choose guns and hanging and things like that that you can't recover from. So it's something to really think about. Suicide is really a very sad thing, especially when young people die that have their whole lives in front of them. So I don't know if I mentioned Kevin Hines before, but he's actually a survivor of a suicide attempt by jumping off the Golden Gate Bridge in San Francisco. And he has a really inspiring story. There's a short video clip, I think it's like 5 minutes, that is after this video, that really talks about his experience. And he actually suffers from bipolar disorder, but didn't know it and was trying to get help and just felt like he was a burden to everybody and felt like this was the answer. And oftentimes that's the case with people who attempt suicide. But if you're feeling that way, or if you have anybody you know that's feeling this way, reach out to some of these hotlines, and don't do it alone. I always hate to put these risk factors up here because it's never your fault if somebody attempts suicide or commits suicide. Even trained counselors and psychologists sometimes don't see it coming, and sometimes it's impossible. The person might seem perfectly fine. The guy from Lincoln Park, I can't remember his name now, that committed suicide, he seemed to be perfectly fine. They showed video video of him singing and hanging out with his family. And, I don't know what happened between that video and when he committed suicide, but it wasn't that long. And something snapped, something happened. And those people that were there had no idea and couldn't have had any idea. So something to think about. It's never your fault if somebody around you attempts suicide or commits suicide. So the last mood disorder I wanted to talk about was bipolar disorder. And it used to be called manic depression. I don't know why they changed the name, but it's now bipolar disorder. But it's basically the same thing. People have episodes of mania and episodes of depression. And I'm going to talk in the next slide about what mania might look like. But just really, people with bipolar 1 have extreme manic episodes and extreme or severe depression. And when they're in these manic episodes, they can become psychotic, delusional, hallucinate, see things that aren't there. They can look pretty crazy. But it's actually due to bipolar disorder, and it's actually very treatable, much more treatable than, say, schizophrenia. 0.8% of the population suffer from bipolar 1, so 1% of people suffer from schizophrenia, so it's a little bit less than schizophrenia. It's definitely more common in men than women. Bipolar 2 disorder is very similar, but the manic episodes are not quite as severe, and the major depression episodes are not quite as severe either. And it's about 1% of the population. So we know there are strong genetic indicators for bipolar 1 and bipolar 2 disorders. I posted a really interesting video about an Olympic runner, Susie Favor Hamilton, that suffered from bipolar disorder. She actually got really severely depressed about missing out on her last Olympics. She just didn't do well in her final run, and she became really severely depressed, and a doctor gave her antidepressant medication, which sent her into a really severe manic episode. And she decided that it would be a good idea to go to Las Vegas and become a call girl. And she really was in this kind of crazy manic episode, but she had a brother who suffered from bipolar disorder, so she had a family history of bipolar disorder, and that antidepressant medication just triggered that manic phase. So bipolar can be a really debilitating, really difficult disorder, but we do have some pretty good treatments for bipolar disorder. People that suffer from bipolar have trouble controlling their emotional state because of the different changes in their brain chemistry in their brain. So manic sounds kind of good, actually, especially right now when we want extra energy and we don't want to have to sleep a lot. Feeling really good about yourself, having grandiose self-esteem sounds pretty good, but it can also be really difficult as well. So you can have racing thoughts where you can't focus, almost like attention deficit, where you just go from thought to thought, idea to idea, and you can't slow yourself down. It can also be really irritable, so it's not always fun. You can be physically agitated where you just can't sit down, you can't stop moving. And then another dark side of mania can also be that you have really poor judgment, you do different things that you could have some pretty serious consequences. So the video I was just talking about, Susie Favor Hamilton, where she decided that somehow being a call girl in Vegas would be a really good idea because she was delusional. She was in this manic state and she just didn't really recognize that this was problematic. So sometimes people will do risky sexual behaviors. They'll go on crazy shopping sprees. They'll buy a car that they can't afford. And of course, when they finally come down from that manic episode, they really regret all the things that they've done, and sometimes they can't all be undone. There's also substance abuse is really common with people who suffer from bipolar disorder. Because it can help with the symptoms, or at least they feel like it helps with the symptoms. So a lot of times it can be really difficult in diagnosing bipolar disorder because we see people as having a substance abuse problem and not necessarily understanding that underlying mood disorder. But there are some pretty good medications out there, are some newer medications out for bipolar disorder. And the goal of the medication is to minimize the lows of depressions and the highs of mania. And many people who suffer from bipolar don't love taking the medication because sometimes that manic phase is where they feel alive. That's one time when they actually feel good. And so taking a medication that takes that away can be difficult, but it does prevent the lows of depression. So lithium, which it comes in lots of different name brands, Escalith and Lithobed, is one of the most common treatments for bipolar disorder, but it does have some kind of negative side effects. It can cause you to feel sick to your stomach and have hand tremors, and it can also cause you to gain like 10 pounds just water weight because it's actually a mineral salt. So, you gain 10 pounds without even eating anything, and that can be a pretty negative side effect. And then you also have to go once a month and get a blood level because it can get dangerous if it gets too high, or if it's not high enough, it's not very effective. So it requires a lot of maintenance. So some people with bipolar disorder don't like to take lithium, but it is kind of the most commonly prescribed medication. And they are coming out with some newer medications now. There have been attempts to use different seizure medications. I'm not sure if they're still used today, but I have seen these used in the past as well. And now they're coming out with a lot of newer antipsychotic medication to control that manic stage. So this Vraylar medication is actually an antipsychotic medication, and it has been shown to be pretty useful for people that suffer from bipolar disorder. But that here again, finding that combination of medication and uh, helping somebody with bipolar disorder can be a challenge. Counseling is always beneficial in helping people understand their disorder and control their disorder and control their thoughts and their thinking as well, just like with the depression. So counseling in combination with medication is really helpful. But bipolar disorder is definitely a strongly biological disorder, and definitely medication is a really important component of treatment for bipolar disorder, and it's definitely not the person's fault that suffers from bipolar disorder. I think oftentimes people don't understand. It's hard to understand, it's hard to relate if you haven't ever had these symptoms before, but definitely be aware and know that people do all experience the world differently and don't have the same brain chemistry, the same ability to cope or deal with different situations that we do. So it can be a really debilitating disorder, but it can look really bad when the person's in a manic phase, but it can be very treated as well. So really important to seek out treatment with that, and counseling as well as medication can be really beneficial. Thank you for listening.